Dr. Zasloff, I really appreciate you taking the time to talk with us. Dr. Zasloff is a former dean at Georgetown University. He's worked as the head of the chief of the human genetics branch of the National Institutes of Child Development at the NIH. He's taught at University of Pennsylvania as well, founded a couple of companies, and the one you're at now that I'm most interested in finding out more about, Dr. Zasloff, is Enterin. Tell me about it.
Well, I've done a lot of science in my life. I've been a basic scientist.
You've been a pediatrician and also a PhD scientist.
PhD. I did a PhD with a Nobel laureate. And I have to tell you that in all of my career, this is the most exciting thing I've ever done, in large part because what we're seeing now is something I didn't anticipate. This is the culmination of a career for me with some wonderful colleagues, Denise Barbutt, Bill Kinney. We're now focused on some of the most terrible diseases of man, and we think we have a whole new way to approach the problem.
Let me ask you about how the gut functions and what you've called the gut-brain axis. What's the gut-brain axis?
It's in the news, so you can almost read about what the gut-brain axis is, I think, if you look at any newspaper. But the gut has a very complex nervous system. There's enormous amounts of information that we don't even fully understand that the gut sends to the brain to let the rest of the body know what's going on in the GI tract. And because the gut's nervous system is so intimately connected with the brain, we now have come to realize that in some cases, if the gut's nervous system is not functioning well, the brain is damaged. And in the case of Parkinson's, which is the focus of Enterin, we have a pretty good idea why that's happening.
Well, about 1 million Americans live with Parkinson's disease now, and 60,000 Americans are newly discovered to have Parkinson's each year. That's an enormous number of people that are suffering from these diseases. 1 in 100 adults over age 60. And the statistics go on and on about how grim the outlook is for them. What I'm hearing you say is that there may be new hope depending on the results of this research.
Yes, there is new hope. There is new hope for those suffering or at risk of Parkinson's.
Tell me more about your talk recently at the Nobel Symposium about this subject.
I was honored to speak at a recent Nobel Symposium on the microbiome, and it was my discussion of what we've recently discovered, I think, that was exciting to the participants of that symposium.
Well, tell me a little bit about what kind of research you've been doing.
So how did I get to where I am?
How did you get here?
It starts with a frog. And it starts with trying to understand how a frog heals after we do surgery on it. And it heals kind of magically. And the reason it heals magically, heals without infection in a non-sterile world, is that it makes fantastic substances in its skin that fends off bacteria. And this was a new discovery, completely new. I started to look at other animals in nature. And one of the remarkable animals that came to my attention was the shark. They had rather primitive immune systems, and yet sharks are extraordinarily hardy and rarely are subject to infection. In fact, there aren't any viruses that are known to infect sharks. It's rather remarkable. Some years ago, after a little bit of work, discovered that that animal makes a powerful substance that is more powerful as an antibiotic than virtually any of the antibiotics we now have available. I called that compound squalene. In this case, you say, well, how has nature solved it? How is an animal more successful than we are? They've lived hundreds of millions of years longer than we have. How have they solved it? And take that molecule, take that substance, and see if we can apply it now to a human disease.
You talk about repairing the dysfunctional gut-brain axis. What and how?
In some diseases, and we've come to realize that Parkinson's is one of those diseases, the nervous system of the gut becomes injured, and it becomes injured early.
Why is that happening?
Well, this gets back to the frog in a way, and the initial interest in the shark. The nervous system of the gut makes a protective substance. It's called alpha-synuclein. To protect itself when it senses a problem, an infection, that substance is now trafficked up through the nerves that connect the gut to the brain and delivered to neurons, nerve tissue within the brain, probably because the gut realizes we've got a problem, we better now protect one of our neighboring cells in the brain, which we are connected to. And it's a brilliant way that the body has to protect itself. And normally that's a good thing, but too much of a good thing is what we believe results in Parkinson's or leads to Parkinson's.
So this is an overreaction?
It's an overreaction, and we believe that diseases like Parkinson's result from an excessive production of this alpha-synuclein.
Now, can the damage be repaired, or is once damaged and it's gone?
We believe that the damage to certain centers in the brain and in the gut can be repaired.
So you're saying that the inevitable neurodegenerative disease isn't inevitable at all if this works?
What I'm saying is precisely that. I'm saying that in certain situations, certain circumstances, when the destructive process is curbed, nerves that have been thought of as having been dead, non-functional, can be revitalized.
Tell me more about how squalene would be able to impede the damaging effects of the alpha-synuclein.
We're going to call it ENT1. And ENT1 is the particular derivative Enterin is studying now in the clinic. But ENT1 is a molecule that loves to go exactly where alpha-synuclein loves to go in a nerve cell. And this is what it looks like. And this is a little tiny tablet. You can barely see it. It's a little guy. When given orally, there's a nerve, it has a membrane. Alpha-synuclein is sticking on that membrane like flies on a flypaper. ENT1 enters. It sticks to that flypaper more tightly, so to speak, or the lining of the nerve membrane, and flips off alpha-synuclein. That restores the function of that nerve. It was previously thought that those nerves were dead because nobody previously could get alpha-synuclein off those nerves. But this compound, which again came from a shark, really, its original creation was natural, has that capacity. Some rather remarkable animal studies strongly support the nervous system of an individual with Parkinson's can get itself together and get rid of that stuff.
Please tell us about the status of the current tests that are being done and what results you're seeing so far.
We have begun a phase 2 clinical trial to evaluate its benefit for man, is now Enterin's current mission. So everything that I just said, which is exciting, still requires validation, and that's what the clinical trial is all about, to test the safety and efficacy of this compound. And the entire Parkinson's community will be informed of those results at that time.
What do you see ahead?
So the sort of overriding, if you wanted to take it to a really big place, go to 30,000 feet now, 40,000 feet. One of the sort of grand ideas that we have that is going to be evaluated and tested in this clinical trial is that when the gut's nervous system isn't functioning properly, the master clock that establishes our circadian rhythm isn't ticking right. The hypothesis that we're operating under, it's the hypothesis that the brain needs to hear from the gut every day and has to hear a certain melody, and that this compound that basically came from a very primitive animal has the capacity to play those notes, activate those notes, even in a nervous system that has been made dysfunctional for any number of reasons. The biggest picture would be that by stimulating the enteric nerves and by restoring the circadian rhythm, many neurodegenerative diseases, far beyond what we've just said, many other human conditions could in fact be impacted. One of those is autism. Both autism and Parkinson's share similarities that previously had not been appreciated.
So we may not know what causes it, but you may have found something that might solve it.
That's definitely possible. It is definitely possible. Now, we won't know that until we begin to do human studies. So it becomes an enormous spectrum of disease emerge as potential targets for Enterin. One of them is called multiple system atrophy. And this is a really severe form of Parkinson's. There's nothing right now available for treatment. And of course, there's Lewy body dementia. There are other, again, conditions related, thinking I should say, about schizophrenia, chronic depression, and even Alzheimer's. The commonality, we believe, is that in some or all of these diseases, by stimulating the enteric nervous system and sending the right musical signal, right musical tone from the gut to the brain and then to the master clock, that we can correct some or all of those conditions. And that hope is driving us forward. There's an enormous expectation that we're going to do good, but there's also an extraordinary excitement about the discovery of new medicine, new science. And we're very fortunate to be in this position.
Thank you very much, Dr. Zasloff, for talking with us today about some of the interesting things that are happening at your company. We appreciate that, and we appreciate the prospects for the future as well. Thank you.